Welcome to Every Woman. We have the doctors of BreastLink here to answer all of your questions. We have Dr. Nimi Kapoor, June Chen, Dr. John West, and Dr. Justin West, his son. We had a lot of viewers ask us about men and breast cancer. I know it's not very common, but, is that something, can men get breast cancer as well? Can you tell us, Dr. West?
Well, they certainly can. The incidence is much lower than in women, and men, unfortunately, don't take very good care of themselves. So, unfortunately, when we've seen Dr. Kapoor can comment on her experience. I know it's extensive, but they tend to let these lumps go. I would say men tend to be oblivious of their body, where women sometimes don't pay as much attention as they should. Men tend, but we've caught a couple of small cancers. We've had our primary care doctors have picked up some on mammograms with questionable lumps. Most of the lumps we see in men, though, are benign.
Okay. And is it mostly for men who are overweight, or can it be for all men?
Well, what's your experience, Nima, on this?
Yeah, it can be for all men. In general, if we see male breast cancer, it's often associated with a family history of breast cancer, often associated with genetic risk factors as well.
So because it's so rare, do you suggest that men do self-exams, or is this something that, just through going to the doctor that they're going to feel, or is it visible?
Both. Actually, yeah.
Yeah, I think, it would be nice if you could get men more in contact with their bodies, more analytical rather than just kind of ignoring things. But the tragedy is it's so easy to feel a change. And maybe the wives ought to participate in this. I think maybe we could have kind of a group approach here, but the men tend just not to think about it. And so these larger cancers, when you should be able to feel a very small change in a man's breast. So I don't know if we can get them to do it, but I think this education is really important, and men out there should be aware of the fact that they are at risk and do.
Well, I think that is part of the problem, is that men are not aware that they could possibly develop breast cancer. So even if they do feel something in their breasts, they're more likely to disregard it and not think that it could possibly be breast cancer. But the truth is, everyone is born with a little bit of breast tissue. So even though male breast cancer accounts for less than 1% of all breast cancer, it's not 0%.
And so how do they get diagnosed?
Usually on physical examination, that they feel a lump, or their wife feels a lump, or the partner feels a lump, or their doctor feels a lump when they go for an annual exam.
Okay. And so at that point, then a mammogram would be suggested. Does it work the same way?
Yes, it does. Imaging is very important. The physicians ordinarily will direct their patients to imaging, and they will receive a mammogram and any additional views on the mammogram, and we would most likely go forth with an ultrasound as well.
Okay. And what are some of the symptoms that, besides the lump and feeling that, are there other symptoms that they might be experiencing that they shouldn't overlook?
Well, sometimes they're tender. Usually they're not. That's kind of the problem. But the last one that I saw was focally tender, and it was a tenderness. He kind of was aware of a little change, but it was really that he waited until it really hurt him. Most of them don't, so that's kind of the problem. It's too bad that they don't.
Occasionally you can even see some skin changes, so that's another thing to look out for. The last male breast cancer I wasn't involved with, he had some skin change. I thought it was just a rash. So those are other important factors to think about.
Well, what are some of the statistics if a man is diagnosed with breast cancer? Are the cure rates the same?
Pretty much the same. It's stage for stage, same as with women with their stage of breast cancer.
Okay, so it's not one of those things that, once men have breast cancer, it's probably at a more advanced stage, or once it's caught for most men?
It can be slightly more advanced because, again, men are less likely to pick it up earlier. They're not typically screened as women are screened. But we still, like Dr. West said, can pick up very early, smaller cancers.
Okay. Now, Dr. West, what about plastic surgery? Do men still get any kind of plastic surgery to kind of make it, not as obvious?
I think the context where it's because you're not trying to rebuild a breast for a man. If the nipple is removed, then we would talk to them about a nipple reconstruction so that they have symmetry between the two breasts, but we don't generally build a breast for a man.
Well, what if he had like a nice pectoral or anything?
Well, the mastectomy shouldn't affect the pectoralis muscle, or cancer surgeons can address that more specifically, but the idea behind the mastectomy is to take out the breast tissue, but we leave the pectoralis behind, but some skin, including the nipples, often removed. And so what you're leaving is essentially skin on top of muscle, which is what most men's breasts are. Now, they may have some fat, they may have some breast tissue, but we don't go in and rebuild a volume.
And do you do any kind of breast reduction for men?
We can. So the context where as plastic surgeons that we see men is usually in the setting of what we call gynecomastia. So Dr. Chen alluded to earlier that men frequently have breast tissue. It's not uncommon at all. So we'll get men typically we see them in their teens, and then we see them again in their 50s and 60s who come in with breast tissue who feel uncomfortable with the way they look. And so we'll reduce that tissue as a gynecomastia surgery where we take out the breast tissue, but in those situations we'd leave the nipple. In the case of a cancer, they would remove that, and then we would reconstruct it if they would want that.
All right. Well, thank you, doctors, for joining us and getting this information out to men. Go out and get your breast checked if you do have any issues. If you want more information, you can go to breastlink.com.
Thank you.